First, we'll go over some responsibilities of a registered nurse. You'll be treating patients, educating patients and the public about medical conditions, providing emotional support and advice to the patients themselves and to their family members. It's very important to record all medical history and symptoms, performing diagnostic tests, and from there forming analysis on what the condition may be. Also, you'll be operating medical machinery, administering treatment and medication, and from there do patient follow-up and rehabilitation if needed. Next, we'll move on to salary. The average annual salary for a registered nurse is $70,000. Employers often will allow flexible work schedules, child care, educational benefits, and bonuses. The great thing about being a registered nurse is there's a great diversity in the jobs they have to offer. With a home patient and a public patient career, you're going to be traveling, so you're traveling the patient's home. There is a lot of walking, bending, and standing with fast pace of a hospital setting. Let's talk about hospital versus office. If you like the fast pace of the hospital setting is going to be great for you, but that also means that there's 24-hour immediate care of all the patients. So with that, there comes working weekends, holidays, and maybe working on call, working nights. So if you're more of a family person and you need those business hours, there's also the option of working in a physician's office or in schools to get those regular hours to be home. A negative point of being a registered nurse is you are going to be vulnerable to injury and disease. You're in constant contact, direct contact with your patient, so that means they're going to be susceptible to anything that these patients have. Luckily, we do have strict guidelines to prevent any harm from happening to the patient and the provider. So here's side effects. Skills and required training. There are 3 typical educational paths in getting into the registered nursing program. PSN is your bachelor's degree. You get this through university. It's about 4 years. The ADN is the associate's degree. You can obtain through a community college like Santa Fe. It takes about 2 to 3 years. The diploma you achieve when you're in the hospital, and that takes about 3 years. The only problem with the ADN and diploma is there's not going to be much advancement opportunity as if you had a bachelor's degree. But once you're in the job setting, like I said before, many employers often offer educational benefits so you can work your way up while working at the hospital. All nursing programs require classroom instruction and clinical experience, which would be in a hospital or other healthcare facilities. After completion of the nursing program, you'll also be required to pass the NCLEX RN, which is the National Council Licensure Examination, and that's in order to obtain your license. Job outlook. Right now, in today's economy, registered nurse is a great opportunity for job security. There are 2.6 million jobs available for RN. Employment is expected to increase, and right now it is the largest amount in today's economy. A great place to start looking for work would be Shands Hospital. It's Alachua County's largest employer with 7,500 workers. Their corporate culture is valuing diversity, providing excellent customer service, and solving problems collaboratively. And it's also Santa Fe's biggest employment partner. So any programs that we have here at Santa Fe, there is employment demand at Shands Hospital. Shands is recognized internationally and nationally for the research that they've done. And that's included with the brain, spine, aging, cancer, genetics, and organ transplant. Shands is a not-for-profit organization, and in 2010, the community was benefited $152.4 million from SHANS, and that was for uninsured patients, donations to education and research. This is a problem that's going on with today. According to Dr. Jennifer Mooney, Floridians could face a shortage of 52,000 nurses by the year 2020. And this could really lead to a crippling of our healthcare system and lowering the quality of care to Floridians. This is mainly due to the baby boomer cohort. Many of the baby boomers are coming to the age of retirement, so there's a need for nurses, but a lot of our nurses are a part of this baby boomer cohort. And because of this drastic shift in history, there's no short-term fix for this. So, what I think is that because of the economy and such a demand for nurses, that this will lead to a decrease in the shortage because people are going to start going back to school to get into the healthcare because everybody wants job security right now. So, I think things will turn around. And that's all I have for today. So if you're interested in being a registered nurse, I would contact your health advisor and see if you can get in and career shadow someone so you can see what field of nursing that best fits you. Thank you.